Okay, hi there. I'm Ryan Welter. I'm with Tristan Medical in North Attleboro. We've been doing a lot of COVID testing for a lot of people, and there's just, I think a lot of people have questions, particularly right now about the travel ban in Massachusetts and what the order really says. Of course, it's not a travel ban, you're able to travel, but when you do travel, you do need to make considerations for testing if you go to any of the states that are higher risk. So if you look at the website, Massachusetts has a very nice website set up for this, for the travel order, and I think that's a good place to start. There's a travel form that you can fill out prior to arrival. Basically the idea is that you have to have a COVID test done within 72 hours prior to your arrival in Massachusetts, or after you arrive, you have to quarantine until you have a COVID test done, and then it could take up to 3 days or 72 hours for that to come back. So ideally, if you were, for example, going to travel to Pennsylvania, you could have a COVID test down in Pennsylvania. You could do that about 3 days before you left the state of Pennsylvania if you found a clinic in Pennsylvania to do it, and then you would come back. You'd be able to hopefully call and get the result as soon as you arrived in Massachusetts 3 days later, and then have that result in hand showing that you hopefully had negative PCR testing for COVID, and you'd be free to go about your business. What normally ends up happening though is you go to Pennsylvania or somewhere else, you come back, and you haven't had your testing, so you can quarantine. That doesn't mean you can't get tested during your quarantine. You can come to a testing facility and get tested at any time and get results. So the important things to realize is that, number one, if you travel outside the state, it doesn't mean you're automatically going to be quarantined for 2 weeks. If you don't have a test done, when you come back, you can have a test done. I think that's an important thing to realize. And number two, it must be a PCR test. That is the only test that the state is allowing at this point for this for the travel order. And I think that's another important consideration to understand. The PCR test is typically done through the nasal swab. It is easy to administer and receive in most cases. And it's opposed to the antigen testing. The antigen testing is a nice rapid test that will tell you whether or not you have COVID at this minute or not, but it's just not reliable just yet. They're new testing, they were just authorized, and the state of Massachusetts has just not allowed those tests to be used for the travel ban just yet. So I think at some point in the future, our Health and Human Services offices will allow those. I think it's prudent to kind of let's see how accurate they end up being in the community, because we did have a lot of problems when the antibody test came out, variable types of sensitivities and specificities from what was reported and what actually happened. So it's prudent to do that. But what it means for right now, the bottom line is that you need to get the PCR testing or the nasal swab testing in order to qualify for the travel ban. Again, very simple to do. It takes all of 30 seconds to administer the test, but it does take a couple days to get back.